health episode which airs on West Nile TV every Thursday from 11 a.m. to noon, where we bring you people in the medical field to educate you, our esteemed viewers, matters regarding your health. Those who are with us last week, you recall we had a session on bacterial sexual transmitted infections, and if you could take a clue, we looked at the chlamydia, we looked at the gonorrhea and syphilis. Yet today we have another package for you, our esteemed viewers, still regarding sexually transmitted infections. However, today we shall look into those which are viral, which could be transmitted through sexual intercourse. However, before we go deep into the course of the discussion, let's first introduce our guests.
All right, thank you for the opportunity. My name is Kiai Marion, a student at Muni University, currently in my year 4, pursuing Bachelor's of Nursing Science, and I've also been for clinical placement. Just currently, we're still in for school practice, but still we shall resume the clinical placement. Thank you.
My name is Mlindwa Charles. I'm also a student nurse from Muni University, pursuing Bachelor of Science in Nursing, currently in year 4, and we are practicing at Arua Regional Referral Hospital in the various units, including the ones that handle the conditions that we are going to look at today.
So we are grateful to the university giving in the students or the people coming to come and educate the viewers of West Nile TV. Our session is going to rotate about sexual transmitted infections, mainly where we shall look into the cervical cancer and the HIV. However, let's first zero down to cervical cancer, because this has been a disease of concern in the entire world, let me say even in Uganda specifically, and we would love to know which people are at risk of getting this cervical cancer, how can it be treated, and even before we get to understand all that, we would love to know what cervical cancer itself is. I turn to my right, Mr. Charles. What's cervical cancer?
Cervical cancer, this refers to the cancer that affects the inlet into the uterus, or what we can call the mouth of the uterus, and that's the cervix. And it's mainly caused by a virus called human papillomavirus in 95% of the cases.
Okay, then I turn to Madame Marion. Since we have gotten to know that this is affecting the womb maybe of the girl children, we would love to know, are there classes for this cervical cancer? Then also would love to know, can also men suffer from cervical cancer?
Thank you so much for that question that you've asked me. First and foremost, I would love to tackle really the root cause of cervical cancer, looking at it being the second ranking cancer in females, and its majority, like I can say, human papillomavirus induced cervical cancer ranks second among the female cancers in the country currently. So looking at the human papillomavirus, which they say is oncogenic in nature, simply meaning it's a cancerous, I can say, virus, because you see majority of the presentations, particularly people presenting with it in the early stages, you will realize that people having the virus are usually asymptomatic. What do I mean here? Asymptomatic simply means someone is not showing signs and symptoms. It later on manifests in its advanced stages where it's even hard to treat. So many of the people usually have this human papillomavirus, and they say it usually resolves on its own, but then there are incidences of persistency. That's why you find with persistency, it ends up inducing various cancers in the human body, particularly for women. So we end up finding things of cervical cancer, cancer of the vagina, which is also one of the cancers affecting women at that. So when you look at the classification of human papillomavirus, it's basically in two ways, and it also it also has manifestations in different strands. So on classification, we basically have the high risk cancer, human papilloma cancer, and then the low risk. High risk usually is the one that causes the cancers. Take, for instance, the cervical cancer of the cervix, which is also cervical cancer at that. And then the low risk usually causes things of aspects of genital warts. It could be genital warts, it could be another form of wart, which can be the plantar, simply meaning the warts on the hand, or the flat warts that are usually common among young children and basically adolescents at that. So looking at this, it's usually it's actually an area of interest and should be the country's area of focus, because human papilloma virus is actually causing very many cancers that affect the human body. Like I said, it's oncogenic and simply meaning cancerous. These are cancerous viruses that just cause abnormal growth that results into an increased abnormal multiplication of cells, particularly in the area that the virus has invaded. So you'll find this human papilloma virus, though in its early stages can be asymptomatic. A person cannot present with signs and symptoms, so it's even very difficult to rule out unless if you carry out particular tests to ascertain whether this person has the virus. Actually, there are those tests that can be carried out, and they say for all the people who are sexually active should actually embrace this ideology of going for testing to rule out whether they have the virus, and if so, they can embark on early interventions of treatment of the virus. Otherwise, its manifestations are usually seen in the later stages that becomes a bit difficult and even hard to treat. And now you find it's associated the disadvantages coming in forms of cancers, cancer of the cervix, cancer of the vagina. It has its own different strands that are responsible for different manifestations in the human body. So we have the HPV-6, there is HPV-11, HPV-16, and HPV-18. So it's just for us to take note and embrace on initiatives of taking care of ourselves and going for these early screening tests to rule out whether we really have the virus, rather than waiting for it in its later stages, which can be a drastic manifestation. Thank you.
Hope our viewers have gotten to understand the different types or maybe of these viruses which can cause this cervical cancer, where even she has got to tell us that these are a cancer, that this is just a rapid cell growth which is not controlled maybe after this infection of the viruses. Then I turn back to Mr. Charles. A viewer would love to know, how can they acquire, or how can this cervical cancer be transmitted?
For the transmission or the acquisition of human papilloma virus, both the dangerous strains or the dangerous parts of the virus and those which are not dangerous, that don't cause cancer, the major way of transmitting it is through sexual contact or contact with other body fluids. This will include the sexual acts like when there is use of genital parts, and also to those who use other means of satisfying themselves sexually with their partners. But also, it can also be acquired through cats. For example, you have a cat and someone also has a wart, and you come into contact with them. They can cause you the acquisition of this virus. And to start, and also to continue, what involve the bumps that form on your skin, on your genitals, or on the soles of your foot. Thank you so much.
I would also love to know, you have told us that mainly this disease affects the ladies. Actually, it affects ladies only, right? Then we would love also, a viewer also would love to know, can a man transmit this virus maybe from one woman to another, though they can't get this infection? Thank you.
Actually, for a man, they have a major role in transmission than in acquisition. You see that if a man has many sexual partners, like has many women that he sleeps with, this will cause him to keep on spreading. If one of the women that he sleeps with has this virus, he will be transferring it to other women. And this will be, the chances of this will be increased if this man is not circumcised. It will be hiding under that cover that has not been removed because this man is not circumcised. Thank you so much.
Often we have you are at in the first step you told us men can't suffer from this, so they could have used it as an opportunity to have multiple sexual partners. Thanks very much for that clarification. Also, you've taken to note it, our viewers, if you're a man, you could also transmit this virus, though it can't affect you, but you could be an agent who transmits it maybe from one lady to another. I come back to you, Madam Marion. We would love to know, in case we have ladies in the community, how can they identify that they have this, or maybe the signs and symptoms that they could be suffering from a cervical cancer? Then also, you will also let us know which people are at risk, or the age of these ladies who are at risk of getting this cervical cancer. Thank you.
Of course, the ladies are affected as this, particularly those ones who are sexually active. So like I said earlier on, one strange thing with this oncogenic virus is that in its early stages, it's usually asymptomatic, whereby someone doesn't have signs, because signs are seen, whereas the symptoms are felt. But then for this particular virus, we get to realize it in most cases when it's the late stages, advanced stages, and it comes with its own associated factors. Take, for instance, now you end up with the cervix, cancer of the cervix. So for the case of the ladies, manifestations that you particularly have this kind of virus, looking at the classification where I broke down into two, we have the low risk classification and then the high risk. For the case of the low risk, we see manifestations in form of genital warts. These are abnormal like growth, sort of swelling, because also basing on the growth. In most cases, it's very hard for us ladies to open up, especially if the problem is coming from that particular area. So you find ladies, especially those ones who are sexually active, presenting at the ward with what we call genital warts. There are just some abnormal growth, like, oh, what can I say they are, but abnormal growth on, I can say, the mole pubis, that is a subcutaneous part of the vagina. You find the area, that particular area that I've stated, are having abnormal growth of the skin because the area has been it has been infected, or the virus has actually invaded that particular area. That is for the low risk, where we see women presenting with genital warts. However, we also have the under classification, where I broke down into two, the high risk classification of the human papilloma virus, where now people present with the cancers. Those are general manifestations of the high risk human papilloma virus. So for the case of cancer, these are now in the advanced stages of the virus, because in the early stages, that was even asymptomatic. And looking at the different strands that cause these different cancers, you'll find that particular strands that cause these cancers in different type of women. So one of the manifestations that were visually seen with the high risk is that we have the abnormal vaginal bleeding. that is one of the manifestations in the high-risk classification of the human papilloma virus, and then also the abnormal vaginal discharge. Abnormal vaginal discharge is one of the manifestations of the high-risk cancer, because now it's at a cancerous stage. Then for the low risk, we find women who are sexually active presenting with genital warts. However, we also have children being affected in these adolescents, whereby they usually present at the hospital with warts at the plantar, simply meaning the hand. You just see abnormal growth, abnormal swelling sort of on the hand, especially this upper hand of the child or of the adolescent. Thank you.
Hope our viewers have gotten to know. In case you get these abnormal outgrowths, the last episode they told us they look like pineapples. So in case you get those outgrowths, please, those could be a sign you're having this cervical cancer. And also she told us the excessive bleeding. So in case you could be experiencing any of those, our viewers, please take keen and maybe reach out to the nearest health facility for specialized management and treatment. Then also I turn back to Mr. Charles. We presume we have a viewer, maybe someone else in the community who has gotten the signs and symptoms Madame Marion told us, and they have come to the hospital. How do they always diagnose, or maybe the confirmatory tests you guys do in the hospital to confirm that a patient or a person has this cervical cancer? Thank you.
Before I continue with the diagnosis, I can also still elaborate on the genital warts that can be detected by our clients that can raise their suspiciousness, and they come for the services. In females, these genital warts can appear on what Marion called the mons. Pubis is that area where the pubic hair grows around the female's genitals, and also they can appear around the vulvas or the lips of the female genitals. And in males, this can be seen on the areas around the scrotum, and also on the pubis or near the penis, and as you move towards the anus. So this requires us, me and you, to examine ourselves always to see that we seek medical attention where necessary, in case we see something has started developing abnormally. Now, for the case of diagnosis, there are basically two tests that are done. One is the pap smear, and the other one is the acetic acid or use of vinegar. For the acetic acid, it is aimed at looking at the strains, or for someone who has genital warts, you will come to the health facility, and they use acetic acid on your genitals, and the test will either confirm if you have or if you do not have. Then for the pap smear, for it, they will collect a specimen from your female reproductive organs, and then it will be taken to the laboratory for review to see if you have these strains that can cause cervical cancer. Also, in some cases, if this is not sufficient, if it is not convincing, you can go for DNA. As you know, for DNA, it normally confirms what is in there, which virus is there, so that we can receive the appropriate treatment. So in case you get the warts, please don't dare to come. We have our UCI or Uganda Cancer Institute service center at Arua Regional Referral Hospital.
We assume you guys again have confirmed maybe the pap smear and the acetic acid, like you find that this person has this human papilloma virus which causes the cervical cancer. How do you always treat and manage such patients?
For the management of these patients, once they are positive for the acetic acid test, we shall continue to treat them. This doesn't mean that they have got the cervical cancer, but they are at risk. But if we confirm with the pap smear then we can use a method called thermocoagulation. For it uses heat you use a rod, then you push it under the female's genitals, and you burn those areas that are that look reddened. But this should not be done if the lady is actively bleeding. Thank you.
I come to Madam Ryan. How can someone like someone in the community prevent getting this HPV, especially our ladies in the societies?
Thank you so much for that question. Although you have customized it to ladies, but I would first begin off with men. Knowing that men are people who usually carry, sexually active men are the ones who usually carry this human papillomavirus. I implore all men who haven't been circumcised to get circumcised at this particular case. And at that you're sexually active, you really need to go and do something about it because of the drastic outcomes that what you carry in there causes to the female gender. So for the ladies, especially a girl child, those ones who are sexually active, there is really a lot to be done because the other opponent carries it and for you don't have it. So there is there are these other methods of family planning. Even if you're sexually active, you can embark on usage of condoms, which lower the chances of you contracting these human papillomavirus. So in case you're going for intercourse or you're to have an intercourse, particularly with those people whom you've known even for quite long, because some of us love at first sight, you end up getting someone, everything is at sight, so you end up doing everything at sight, which is not okay because you've not actually done some of the precautions that you need to have taken to make sure that whatever you're doing is safe. So the virus being one of the ways that it's being transmitted is actually sexually. It's through sexual contact, depending on the areas that people are using for sex. But otherwise, there are those ones who even like having anal sex through using that particular part, the anus. There are those ones who like oral sex. There are those ones who use a vagina. So whatever the case is, because we see then in the manifestations, depending on the area that you had contact with the infected person, is where the manifestations are. You even see, sorry for going back, but aspects of cancer of the tonsils. You see other things of larynx, cancer of the larynx, which is coming directly from the aspect of oral sex. So in all this, knowing that men are carriers and someone is not even showing signs and symptoms of him being a carrier, then there is need for us ladies to take precautions. So, and at that, I would implore all ladies, those ones who are sexually active, to always be using condoms for this, and proper use at that, because there is using condoms, but it's not in a proper way. It can also make you get the virus, because using condoms in a proper way lowers the chances of you getting the virus. They also said another way of transmission is cuts on the body, provided that you get in touch with any other person who is infected and those secretions get in touch, you're also at a high risk of getting this. So always make sure that in public, in whichever place you are, minimize getting close contact, skin to skin, because you're in a hurry, something like that. If the other person is a carrier, then you're at high chances of getting it. Another thing that I would dwell so much on is on vaccination, especially that some people, especially young girls, sometimes become sexually active very early. By the age of 10, people are already experimenting, because now they're curious basing on the puberty and adolescent stages, physiological processes in their bodies. You find that some people are curious to experiment. And now, especially those ones with even little parental guidance, And even at school, senior women teachers, senior male teachers are not doing their part. You find these kids are left on their own. Nowadays, everything is going.com. We are bringing up kids that are groomed up by TikTok, groomed up by any other app that basically majority of them like using and what. So you end up seeing in this, people end up doing things, trying out things, which is not a crime at that, but it's not even at the right time. It's not right at that particular time. Okay. So for our young girls who have had so many government initiatives trying to address many of the health conditions that come up, one of the government programs that has been on and is still on is vaccination. Vaccination against the human papilloma virus. That majority of the times what they do, they move to all primary schools, secondary schools, because some people would have reached secondary by then but could have missed the virus. And many of the community settings, depending on the magnitude of awareness campaigns that have carried, you find them gathering in one particular area to carry out the vaccination. So vaccination against the virus just helps us curb the effect of the virus and even stop its counteract, I can say, the factors that would have, cancers that would have come on board if in case one hadn't gotten the virus, or in case one got in touch with someone who had the virus. So there is need for public community to embrace the idea of vaccination. And then also because you see many of the cancers, cervical cancers, are induced by the human papilloma virus. So for those ones, people can always go to the hospital for what we call cervical cancer screening. This also helps us in case you could have escaped the symptomatic stage, and even still at cervical cancer early stages you're not still aware of, please go to the nearby health facilities, because in most cases cervical cancer screening is free of charge. Go screen for the cervical cancer. In case it's there, they can intervene and curb down, because we said this is an oncogenic virus. It's cancerous at that. And looking at the cancers that come with failure for you to adhere the precautions that curb down the transmission and also the spread of this virus. You even find cancers of the penis, because depending on the area of preference, for those ones who use anal, oral, different cancers of the parts that are being used for sexual intercourse. So there is need for us to embrace vaccination, use of condoms to lower down the chances of acquiring this virus. Thank you.
Hope the viewers have gotten to take keen part of the preventive measures. However, also what I noted, we are African men, so we should be faithful to one partner. All right, thank you very much. Let's first break up for a breather, then we shall be back in the next segment where we shall look into the complications. Thank you.
West Nile TV, lighting up the region.
Kylian Mbappe. Jude Bellingham, Vinicius Jr., Lamine Yamal, Antoine Griezmann. La Liga comes to Star Times.
A wild celebration!
The big stars, the tiki-taka football, Real Madrid and Barcelona live in your living room.
Real Madrid, a team of dreams!
Catch all 380 games live and in HD on Sports Premium Channel 259 and Channel 246 starting this August 15th. Subscribe to StarTimes Classic or Smart Bouquet at 36,000 Uganda shillings to enjoy the football experience affordably. StarTimes Football and limited passion.
West Nile TV, lighting up the region.
We'll be back, our dear viewers, from that short commercial breather. I'm still Sunday Junior Tom, your program's host, and those who could have just joined in. Today we are looking at the sexually transmitted infections, where we had two guests today on set, Madam Marion and also Mr. Charles, who took us through in the first segment HPV, or what we call human papillomavirus, which is the leading cause of the cervical cancers, and we have seen this often affecting our girls in the society, where they told us it affects them mainly when they tend to the sexual active ages, maybe most from 10, others from 13 and onwards. Then they encouraged us to do these screenings and also vaccination. However, for the men, you know, we are in an African setting, they told us to be faithful to one woman. Though it can't affect us, the men, we could be agents of transmission, whereby you could pick it from your lady number and take it to lady number 2 to lady number 3, and the cycle could just be a continuous one. Then, however, before we proceed, we shall go back to Mr. Charles, who will take us through the complications, then we will unveil our next step. Thank you.
Thank you so much, Marion, for the prevention you have given. Additionally, for cervical cancer or the human papillomavirus, when we are preventing it, we need to vaccinate those, especially the young girls at 19 to 14 years. And the reason being, at this time, these girls have not yet been sexually active, or they have not started involving themselves in the sexual act. So we vaccinate them earlier, so that at the time of exposure to this virus, because mostly it is spread through sexual contact, they will be having some immunity or some ability to fight it. And also, screening, as we saw, HIV infection and the other infections that reduce the immunity are one of the things that can increase this woman's or a mother's chances of developing cancer from an HPV infection. So we encourage that the mothers who are attending the ART clinic or the antiretroviral therapy clinic at various health facilities, they should turn up also to the UCI or the cancer facilities so that they are screened, especially that is 25 years, those who are above 25 years. But generally, in a general population, if you are there and you see you don't have this, this virus, the AIDS or the HIV, you also need to come if you are around 30 years, because we imagine that during that period, you have been undergoing a series of what? Sexual activity. And also, the vaccine that we are talking of, there may be some myths or some conspiracies about this, but research-based information shows that this vaccine is safe and effective for our children. It is not harmful. Well, now let me tackle the complications. The complications, the first one, as Marion said, can involve the oral infections and the throat infections. That will include your tonsils swelling, having lesions or breakages in your mouth, and also around the ribs. And the worst thing of this, it can cause you cancers, especially as we had seen the high risk human papillomavirus can cause among the, if 100 women get this virus, at least 95% will develop cervical cancer if left untreated. And it can first keep quiet within your body, then it might manifest itself even up to 20 years.
Hope our viewers have gotten to note that one of the complications could be a lifetime infertility where they will remove the uterus, but however for us we call it the womb. I have a friend, he told me often people who have HIV, the ladies, are more prone to getting this cervical cancer. Could you give us an explanation as to why these ladies are more prone to getting the cervical cancer?
The correlation between a human papilloma virus and HIV virus, looking at the HIV, which basically tackles the immune system. Once it's in the body, it weakens the immune system. And looking at the human papilloma virus, that is cancerous as that, when even the body's immunity is there, it still causes the abnormal uncontrolled growth of body cells. So with the weakened immune system, you find that the human papilloma virus is at its maxima of working. So you'll find it's at its maxima, and then its associated factors also will come in eventually, which are so destructive to the human body. Thank you.
Hope our viewers, you have gotten at least a highlight of what cervical cancer is and also the human papillomavirus, and we have seen how it could come up. Then also we are going to tackle another sexual transmitted infection, which is HIV. I know most people in the community, they could know what HIV is. However, also we'll get to know a detailed form of HIV. I'm going to go to Mr. Charles. Could you kindly also elaborate to our viewers what HIV is and also which people are more prone to getting this infection? Thank you.
We are continuing with our discussion today, and we are looking now at HIV and AIDS. But what's HIV? HIV in full is the human immunodeficiency virus. This is a virus that affects our immunity. It is mainly acquired sexually as you get into contact with the body fluid. It can also be acquired from a mother to a child as the child passes through an infected bee, but can or as the child is being delivered. Then when we got AIDS, AIDS can be defined as but to start, AIDS in full is the acquired immunodeficiency syndrome, and for it can be defined as the advanced stage of the disease, where now you start manifesting with the what? With the symptoms. And up to date, statistics from the World Health Organization show that we have lost approximately 42 million people to this disease. And just last year, research published that 630,000 people died of it, and 1.3 million people acquired this disease. So we shall now need to look at how to prevent it. And what predisposes you to this disease? You normally get predisposed to this disease if you have unprotected sex with someone who is infected with what? With HIV. And also, if you share the materials that can help you, like if you share nail cutters, razor blades, and also if you are reckless and you get into contact with what other people have given out, like that has come out of their body.
I know our viewers could be knowing what HIV is all about. However, let's get it just as a highlight. I come to Madam Marion. We have seen often in the community people get HIV. What are some of the ways, apart from maybe what Charles said, other ways in which people in the community could acquire HIV? And we have seen it being more rampant in people in the adolescent ages. Thank you.
Ways of acquisition of HIV, what I can say is there are various ways. There are various ways you can get the virus, provided that in that particular way, there is an aspect of exposure of your body to maybe the secretions from another person who is infected. In that particular sort of circumstance, it involves, like I can say, invasive, something that goes through your skin, something like that, something that goes through your skin and exposes your skin. So you can see in society, basically the adolescents, these are people who are having so many physiological, psychological, and all different types of processes going through their bodies. You know, one thing with them is that these are people who are curious, and looking at adolescent stage, majority of them lie in O level, though sometimes it begins off with depending on the person's level of education, but those ones who begin off right away from primary. But now at those ones at secondary institutions of learning, you find that there is this element of sharing of items, provided that the person you're sharing those sharp equipments with is infected. That is one of the conditions that you'll eventually get the HIV, that you'll eventually get the disease. The other person must be infected, and then the item that you're using will get in touch with your with your inner, I can say, invasive, like a procedure that exposes your inner body tissues, provided that something cuts your skin. One, the other person has to be infected. Another, the item of the infected person that you're using cuts your skin, or generally cuts your body, then automatically you'll get the virus. So you'll find many of the adolescents in O-level schools, they'll want to share items. Share items. Take for instance, maybe razor blades you use for cutting your fingernails, or any other sharp item, or even needles. We see girls at that particular level want to increase on their beauty, so they tend to use maybe pins, these sewing needles for pricking ears. So in the dormitory there, you can decide to sit down and you're like, today we're pricking so and so. So from this part, and there are no precautions, like there are no sterile mechanisms used on this particular needle that will ensure that what came from this person ends here and its kill does not end up going to the next person. No. Or you will even find them using thorns. They prick you, they say this thorn is very sharp. Use on one and use on the other, and especially schools up country. But now you'll find for those others in those other parts of the country, what we call pistols, which is a bit safe, which is actually safe. They use pistols. So for these ones up country, and stage is disturbing you quite much. Even those ones in those central parts of the country, people want to tattoo themselves, and of course you have to use an item that can prick your body. So one person ends up tattooing, another and will come and give me also, I use to tattoo myself, and you find these procedures are invasive. Blood ends up coming out of one person's body And of course, it also lands on the particular item that they're using. So you end up using one item, the other colleague of yours also uses that, you'll find that the virus is carried. Leave alone that adolescents are people who are usually curious. They want to experiment majority of the things that they do. But now, yeah, those other things are okay, but experimenting on sexual sort of things is not right. And there is also that, and also experimenting it in a very, like, without precautions being taken. So you might decide to experiment with your new boyfriend, first boyfriend at that, not knowing that the person, the boy, is infected, or you've decided to get a sugar daddy, someone very bigger than, or way far older than you, but just has the money. So some of these people could be carrying the virus, and eventually you end up acquiring the virus from that particular person. Also, we have adolescents who are already mothers. These are people within that particular range of ages who are already mothers. You find that maybe you could have, because fear of people seeing you, and also fear of the comments and harassments that come from the medical workers when you go to, maybe during labor when you go. So you end up seeing many of these children resolve to having birth at home, and who are there to help them are these traditional birth attendants. And provided that the other person who is aiding is infected during the process of cutting the umbilical cord and so forth, and the other person cuts him or herself, particularly herself, you will end up contracting the virus. So depending on whichever circumstance that you're in, even accidents, when you're traveling to school and you happen to be involved in an accident, God forbid, and your blood, because now you've sustained so many cuts or bruises on your skin, you end up in that particular collision of the accident, your blood gets in touch, or the other person's blood gets in touch with your body, cut exposed body tissues. Now you end up contracting the virus, right? So in whichever circumstance that you're in that necessitates you using an item or coming in touch with someone who has the virus, and that coincidence makes it come in touch with your body, like the internal, like I can say, any invasive process. Thank you.
Hope the viewers have gotten to know, especially these adolescents, why they are having high rates of HIV transmission. However, also I jump out to Mr. Charles. What are some of the youth-friendly measures which can be set up or which are already being implemented in order to reduce the transmission in the young adults? Thank you.
How to prevent this disease, the HIV/AIDS that is affecting us, either individually or those who love. They can include using a male and a female, or a female condom correctly. This involves using either, if you decide to use a male condom, then your female partner should not use. Or if you decide to use a female condom, then your male partner should not use one. So you should use one at a time, either male or female. And also, these are now already available. We have our government of Uganda condoms, so we don't have now a limit that to those who cannot access it, especially the young adolescents, that they can't apply it because they are given free at the reproductive health clinic. And also, another way of preventing it is by going in for the safe male medical circumcision. This involves the removal of the prepuce, or the covering of the gland of the penis, or that skin on the penis that can harbor the infection. So if you remove it, you will be able to reduce the chances, because if after the sexual act you go and play, you can be able at least to wash out part of the infectious agents. And also getting tested for this HIV/AIDS routinely. It can involve you going, especially after every 3 months, to test for this, especially for those who are sexually active and those who are high risk that are being exposed to this virus. And these services are already available at many health facilities in our area, in Arua and the whole of West Nile. So you can readily access them and you know your status for better outcomes. And also, we avoid using harmful objects. For example, those who use drugs, they should avoid treating themselves as Mario and said with unsterile or things that are being used by other people. Additionally, and the last information that I can give, to the HIV positive mothers, we need to reach out to the antenatal clinic in our area so that we can receive the care that is required during our pregnancy, and also to reach out to the art clinic or the clinic where we get our medicines so that we can treat this and reduce the virus load in our body so that our child in the end doesn't get infected and at last we attain a skilled birth attendant.
All right. Thank you very much, Mr. Charles. I come back to you. How does circumcision reduce the rate of transmission of HIV? Then also you'll give in your conclusion remarks. Thank you.
Circumcision basically involves, as we have seen, the removal of the prerequisite or that over skin on your penis, so that it will now leave the glands exposed. And in this case, it will reduce those chances of you receiving the infected fluids from your female partner in case of unprotected sex that may harbor into under that skin and get absorbed, because that skin on the inner part of the skin it is like what we say at the lips, it is mucus-like, so the virus can easily enter. And also, to conclude this, I will thank you all for having spent this time listening to us, and for Mr. Sunday Junior Tom for being our moderator this evening.
Also, I come to Madame Marion. You could give in your conclusion remarks as we come to the end of the program.
Since we have come to the conclusion, but I would love to pass a message. So for the case of adolescents, we parents need to come on board. We should understand the type of, like all of us have gone through the stages, but it needs keen attention. These are people whom you don't need to command at that particular stage. Rather, you should sit them down at round table and discuss, because literally science says that these people have a lot of physiological, psychosocial even changes taking place in their bodies. So it might look like you're the father of the home, what you say is a law, it's a command and what. But you know, these are people who are curious. They'll even go against it to see what you will do. And you'll also see their reaction, sort of thing like that. And also coming back to their body changes, these are people who are literally curious about knowing how each and every system functions in their body. And they start seeing now that some of the changes that they're appreciating so much, they've grown, everything has literally increased in size. And looking at the type of children we have nowadays, where young girls fear pregnancy more than, they fear pregnancy more than getting any other STI or UTI. That's a bit demoralizing, because you might get this virus thinking that the major thing here was to survive pregnancy. Now that pregnancy is there, I'm safe. No, but let's embrace other, in case even were to go to these kind of acts, we need to take precautions. Many of us say that you only need a contraceptive, you need a pill and you're safe like that. But a pill doesn't make you safe, doesn't render you safeness from HIV, doesn't render you safe from the human papilloma virus. It does not render you that protection. So it's always good to take maximum precaution. And then particularly for adolescents, these are people who are still young. What I would say for adolescents, looking at West Nile region almost being second with teenage pregnancies in the country, which is alarming. Look at the poverty levels. One of the famous scholars said, that was by Nelson Mandela, the only way of changing society is through education. Education is the only weapon we can use to eradicate poverty. So what am I trying to say here? For the case of my adolescents, I think of sharing things. Yes, your sisters, your friends, your best of friends, I can say, but that does not mean that even your status are best of friends. So you should take necessary precautions when you find people are pricking their ears and you also want to, yes, it's one of the ways of adding beauty. There is need for us to take necessary precautions. And then general, let's embrace education. Looking at West Nile, it's one of the big regions in the country, but look at the education status, look at the poverty status, which are all alarming. It all begins from here. Now, if you get pregnant at an early age, you'll turn out to be a burden to your parents, yet actually they're in their later stages of life that they should enjoy life as they're exiting earth. But no, some of us decide to go that way around. So let's just embrace education, take necessary precautions, stop this thing of fearing pregnancy more than these other sexually transmitted diseases. Take the necessary precautions. If better, abstain. Thank you.
Thank you very much, Madam Marie.